Christian Medical College, Vellore, started 120 years ago by Dr. Ida Sophia Scudder with the motto "Not to be served but to serve," is one of the best medical colleges in India as of now. The Department of Hematology is one of the first specialization departments in the country and is one of the largest hematopoietic stem cell transplant center, which has done more than 2000 transplants. We are grateful to Coal India Limited, who has chosen CMC as one of the centers to implement its Bal Sewa Yojana program. Dr. Vikram Matthews, one of the top hematologists, takes care of the program in the department.
My name is Dr. Vikram Matthews. I work in the Department of Hematology at Christian Medical College, Vellore. On behalf of the department, I'd like to sincerely convey our gratitude to the Ministry of Family Health and Welfare and Coal India Limited for the program of Thalassemia Bal Sewa Yojana, which has been incredibly beneficial to patients in the low socioeconomic bracket to avail and access a one-time curative therapy of allogeneic stem cell transplantation. We have certainly been able to use this program effectively, and we have done more than 94 thalassemia transplants at our center alone. We are also grateful that the same mechanism has been extended for patients with severe aplastic anemia, at least children with severe aplastic anemia. This is another disease which is fairly common in India, unfortunately, and again we have a one-time curative therapy, and through this program we are able to serve a population who would not have otherwise been able to even dream of having this curative therapy. Once again, I think this is an incredibly useful venture and mode and mechanism of funding patients who could not otherwise normally be able to access expensive therapies such as this. I'm sure that this program will grow from strength to strength, and I hope in addition to the current partners, there will be more partner hospitals and more companies like CIL willing to fund programs like this in the country. This is really needed for a large proportion of our patients who cannot access these high-end technologies which offer a one-time curative therapy. While thalassemia is excellent, there are many other diseases which could benefit from a similar approach. Thank you once again for everyone who has made this possible.
The Department of Hematology is currently headed by Dr. Biju George, who is one of the top hematologists in the country. Hematopoietic stem cell transplant is a complex process involving various departments and the process of various tests. A coordinator plays a pivotal role and serves as the first point of contact in starting this process. Mahalakshmi, who has been with us for a long time, coordinates and makes the final plan for the transplant and takes care of the transplant logistics. Social workers help patients with the financial and social factors. They help in getting all the documents according to the requirements and help the patients till discharge. Our senior social worker, Mrs. Gomati Joseph, who has been with us for the last 2 decades, who has pioneered this work. She is now joined by Rizwana, who will continue this process of helping the patients. Nursing coordinators play an important interface between clinicians and patients and ensure timely events occur. The nursing coordinators take care of all the clinical aspects while planning the transplant process. This is done by one of our senior sisters, Deva Kirubai, who has been with us for the last 2 decades. She is accompanied by Sister Beulah Augustine, who is also here for a last decade. They have been joined by Sister Nadia and Sister Zita, who are continuing this process and contributing as nursing coordinators. Children spend a long time in the hospital during transplant. Keeping them occupied in a fruitful way is a task. Our play therapist Y Jayanti takes care of that part by engaging children in craft activities, reading and games. On behalf of the department and the institution, we thank Coal India Limited for making an immense difference in the lives of our children. Thank you, Coal India.
Thank you, Coal India.